Now we're going to cover body fluid cleanup. And before we get started, I think it's important to realize, as you can see here, we've done this kind of the scene size up. We realize we've got some contaminated objects. We have a sharp object or potentially sharp object that's contaminated as well, but the difference here is that it's not disposable necessarily. So we're going to talk about how to deal with that as well. Now we also have our biohazard container. This is a bag in this case because we don't really need to have a sharps container. We're going to be throwing carrots in there. They're not really sharp, but they're too soaked and saturated to go into the normal receptacle. And then we have extra pairs of clean gloves, plenty of towels, and then we have a disinfecting solution. If you're going to use household bleach, it needs to be 1 part to 10 parts water. Or if you're making a large amount for like the floor or a bigger spill, it's going to be a 1/4 cup of bleach to a gallon of water. Now, remember, other commercial disinfectants that are registered with the EPA as effective against HIV, hepatitis B may be used, but make sure you check the label before you trust it. So as we get ready here, we're going to make sure that we have our personal protective equipment on. If I thought that there was any risk of getting splashed, I would even have maybe a face shield or eye shield. In this case, gloves should be adequate. Now we're going to take this sharp object out of the scenario. If there's a large amount of blood on there, and there's a decent amount, I'm going to wipe it off carefully and then place the object into the sink that's right next to me. If you didn't have a sink, you might put it into a bucket or into a container and deal with it carefully after that. Now, after that, we have this environment here that needs to be cleaned up. These aren't contaminated, but I'm not going to risk it, so I'm just going to throw it into the bag carefully, being careful not to cross-contaminate. I grab another paper towel in this case, and I grab the rest. And then wipe up the bulk of the body fluid and carefully put it into the bag. As you can see, most of this is taken care of, but I did get some on my hands. So remember, the glove on glove, skin on skin, we're going to go ahead and take this pair of gloves off, being careful not to snap or pop the glove and spray the contamination. Then using the skin on skin rule, I untuck that hand, contamination's on the inside, clean is on the outside. And I tuck that into the bag, being careful not to reach in and contaminate my skin. Now before I reach for my clean container, I'm going to go ahead and don clean gloves. Now it can be kind of a pain, especially if your hands are sweaty, so be patient, because if you rip them or tear them, and there's loss of integrity in the glove itself, it's not going to do anybody any good. So we need to make sure to have them on and have them be intact. If you see any rips or tears, take them off and put a new pair on. Now I have clean gloves. I can grab my clean container and spray my surface. I like to do it in a spray. That was more of a stream. Now we're going to do it light enough that we don't contaminate or shoot contaminant all over the area. Notice I know where the contamination was at, but I'm kind of going out in a radius that I know it's covered. Now, I set this aside, I grab another paper towel or two, and I begin wiping this up. Being sure to wipe up all of the contamination that I can visibly see. And again, because I have a sink here, I'm going to move this into the sink where I'm going to decontaminate that as well. This has contamination on it. I'm going to put it into the biohazard bag. If I now go to my spray, which I'm going to, I need to take these gloves off and don one more clean pair of gloves. It's really, something that's common sense. I mean, I grabbed a paper towel, I wiped up more contamination. The paper towel is wet, so it probably wicked the contamination towards my hands. So even if I can't visibly see it, I like to practice making sure I have clean gloves when I touch clean things. Now, I'm going to go ahead and spray the rest of the surface. If I see any other contamination, I'll wipe it down. In this case, I didn't see any of it. So I'm going to spray it and make sure that it's soaking wet. And then we're going to let it evaporate to dry. It needs to at least be on the contact of the contamination for no less than 10 minutes. And that's about an evaporation time. Now we have our contamination in the sink. That's when I would actually take my solutions and clean those appropriately using the same method, making sure to be careful not to get poked or to get any sharps. Once our biohaz bag is filled, we go ahead and carefully seal it up and put it with our other regulated waste.